We have patients come in and say, Doc, what can you do for me for facial rejuvenation? So when I look at them, I tell them the number one area to focus on is the periorbital or eye area. That makes the biggest aesthetic change. Two is the nose, three is around the mouth or perioral, and fourth is the skin. So when we look at the periorbital area, I wrote a paper that was published in a peer-reviewed journal looking at that. The number one thing we look at is the upper eyelid. If you look at that, you need to look at the lower eyelid. If you look at that, we have to look at the indentation or tear trough. Then you look at the midface, and finally, the brow. When you have a brow that's ptotic, studies show a significant improvement in the perceived age of the patient when you do your brow with eyelid surgery. So, what can you do? You can do a brow lift. We do it surgically, but other ways that are minimally invasive or non surgical to do a brow lift, you can do neuromodulators like Botox, Xeomin, and Dysport. You can inject that below the brow area and not along the forehead, and the muscles of the frontalis will lift your brow. One of the things that we popularized and have a paper that's published on this is using a Bellafill brow lift. We can go and put a filler either medially or laterally. Sometimes we do the entire brow. 85% of people are effectively treated by using a half a syringe per side. Some need one per side, and it elevates the brow about 2.1 millimeters on average. So without surgery, in a 3-minute procedure, we can get a medial and or lateral brow lift, not needing a surgical procedure.